Welcome to this very first webinar that we're putting on with SPED Homeschool and partnering with Throga to bring you some practical ideas for speech therapy techniques and nurturing communication skills in your homeschool kids. I'm excited to bring Richard on, and I am going to have him introduce himself mostly, but I want to read you a little bit. Richard is a best-selling author in vocational education, a 3-time Guinness World Record holder, and founder of the Vocal Gym for Homeschool. And he is going to equip you today with valuable skills and strategies to create a nurturing environment where your child's communication can flourish. Welcome. I'm so excited that you're here to join us. And thank you so much for taking time out of your schedule to share with our parents.
Oh, of course. Thank you, Peggy, for the introduction. And hello, everybody. Let me start off with discussing what the most common speech disorders are. And some of you, I'm sure, are already well versed in this, and others may be brand new to this. Maybe you're just discovering something. Maybe you're just curious within you or a family member, your child, obviously. So there's 3 common speech disorders. We have articulation disorders, fluency disorders, and phonological disorders. And they're fancy names, but basically what it comes down to is articulation disorders is when something affects the production of speech sounds. So we have substitutions, like if you hear someone say wabbit instead of rabbit, the W and R, that's a really common one. There's omissions. So a child might say cool instead of school, kind of taking out a consonant, or sometimes even a whole syllable. Or distortions, and that could be like a lisp, like where the tongue gets stuck in a certain position. The other disorder that's common is fluency disorders, which is commonly known as just stuttering. And that involves disruptions in the natural flow of speech. That could be repetitions, like I want something. It could be prolongations. So if someone's saying the word school again, it could be like stuck on the S. Or there can be blocks, which is where there's just a temporary speech halt. So it could be, I want to go to school. It could be just a pause that maybe wasn't intended. The phonological disorders, the third most common, has to do with the patterns of speech, of sound airs that affect language. So that's either repeating syllables, like baba instead of bottle, just take the first syllable and loop it, because the child can hear there's more to the word than ba, so you repeat the first thing. The other phonological disorder is when you simplify complex sound patterns, like tat instead of cat, because using the 2 T's is less complicated than using a k sound and then a T at the end of the word. And then there is deleting certain sounds altogether, which is similar to omission, and it has to do with more of the cause of why that disorder exists, which is something I'm going to get into in just a moment. I want to point out too that we all go through different phases of this during our learning, the learning processes, as we mimic mom and dad learning how to speak in the first place. So baba doesn't mean your child has a learning disorder. It's just if there's a threshold of time, if they're getting older and they're still stuck with certain traits, just as a quick little example, that may raise a flag of something that can be looked into and addressed. So they're widely vary in severity and triggers and related behaviors. So there's no one definition, or very rarely there's a singular definition that someone falls under very specifically. It tends to kind of overlap a little bit. Now, the causes of speech disorders, again, vary. Auditory is a huge one. That's difficulty perceiving and processing auditory information related to speech. That can include hearing impairments, auditory processing disorders that causes challenges being able to identify the difference between certain sounds. So like a ch versus a sh might be difficult to hear the difference. And then there's phonological awareness issues affecting the ability to recognize and manipulate sounds. They might not be able to recognize the word altogether. The other cause is cognitive related, and that's language and communication challenges rooted in cognitive processes. And that influences the ability to express oneself coherently. That includes language processing disorders that hinder understanding and using language effectively, working memory limitations, which impact speech quite a bit, and executive function deficits is the term. And that affects the organization and planning of speech. And the third kind of underlining cause is physical. And that is when someone has difficulties with the anatomical, muscular, or motor control factors that affect speech. And that can include anatomical variations genetically, the physical structure of their body. They might have weak oral muscles, causing speech sound disorders, or motor control problems leading to hesitation or even stuttering. Now, where I fit into this is that my background actually focuses more on the physical aspect. So I'm a vocal coach. I've been teaching for 25 years. Singing did not come naturally to me. Part of it had to do with my hearing. At 16, I only had 40% comprehensive hearing with a 70% overall hearing loss. Over time, my brain, through some neuroplasticity, kind of rewired itself, and I have perfect hearing, better than perfect hearing in one ear, and one ear completely gone. So I only hear in mono. But during the time of growing up and having tubes in my ears and starting to learn sign language had a big impact in my ability to hear sounds and read as a whole, let alone how that affected my singing as well. So I found different teachers. This was way before YouTube, so I couldn't just click search on Google and YouTube and get a video to show me how to sing. I went to different local teachers, and I got really frustrated because I had trouble controlling my breath. I had trouble finding the pitch, and I had trouble pronouncing the words and really telling the story I wanted to tell. And the issue I found was in that teaching, a lot of the teachers presented abstract concepts because we can't see, touch, and feel this instrument, which, by the way, is the same instrument you use for speaking, and we're going to make that connection. So they might say, oh, to get vibrato, imagine a windmill twirling in the distance, and you can magically sing with vibrato. I was very literal, and all those abstract concepts didn't work. So over time, I figured out to break open anatomy books and study neurology and figure out the mechanics of exactly how the instrument worked. And over time, that led to a systematic approach that I call the 7 dimensions of singing. It's actually the only vocal technique in history to be awarded a US patent. And that's because I tied it into the muscular structure of how the instrument works. So over the years, I noticed the same story coming back to me, but not just with singers, also with speakers, public speakers and teachers. And when they went to speech therapists or they went to other vocal coaches, the things they learned helped for a second, and then they found themselves kind of leveling off. And so you may be able to relate to that, maybe with your child. Maybe they went to therapy and they found some things work and then just kind of leveled off. Or you found conflicting information. Online says this, but my therapist says this, but my best friend who went through this says this. And that clash of ideas can be really frustrating and off-putting. So I started to make the connection between my personal experience with singing and what a lot of people were going through with being able to just speak and be able to communicate as a whole. So my goal today is to use that approach, understanding the mechanics of how the body, your instrument works, and how it relates to speech, how it relates to communicating. It has to do with tone, it has to do with expression, it has to do with articulating the words in a way, and also being able to listen and teaching your children to listen and learn from that process. I want to instill the importance of understanding the voice. If you can recognize what they are going through, what their challenges are, if you can understand that more, then you can help them quicker. You can get them the right help faster if you understand the vocal mechanics. And it also empowers you to make better decisions, get them to the right person, and be able to communicate what those challenges are with a speech therapist. And most importantly, to find the right one, right? We've probably all had experience of Just because someone's a doctor doesn't mean they're the right doctor for your circumstance. It's the same thing with speech therapy. It's the same thing with me as a vocal coach. I might not be the right person for you. That's okay. I don't take offense. I'm here to help in any way that I can. So let's start here. What I want to do is introduce you to the basic mechanics of how the instrument works. I want you to understand how sound is actually produced. Right now we're in the vocal gym. This is a course for homeschoolers to learn how to sing. And it overlaps, as I said, a lot with speech. So I just want to play you this one video. It's only a few minutes long. Here we go.
Before we can dive into the steps on how we can improve our voices, we first have to look at how the instrument actually works. The voice isn't your typical instrument. It's not one that we can put our hands on by plucking a string, pressing a key, or beating a drum. But did you know that there is only one instrument directly connected to your brain? And that instrument is your voice. So how does the brain control our voice? Well, with speaking or singing, it starts with the brain telling our body to take the first step, and that's to inhale. Just take a breath. The brain tells a group of muscles around the lungs to flex, and that stretches our lungs out, filling them with air. Once that air is in our lungs, we're ready to begin what's known as the cycle of phonation. There are 4 key steps to the cycle of phonation: actuation, vibration, resonation, and articulation. Don't worry, it sounds more complicated than it actually is. Let's go through them, starting with actuation, or the action that starts the cycle. For our voice, those muscles we were just flexing to take air in, they relax and work with the muscles that we use to exhale in a controlled release from our lungs into our larynx, where the next part happens. Vibration. Air brushes up against our vocal folds inside the larynx, causing them to wiggle and vibrate. That vibration creates a sound wave. The position of the vocal folds, how tight or how loose they are when the air causes them to vibrate, is going to determine how high or how low the pitch of that sound wave is. When that tiny sound wave continues its journey, it needs a place to get louder so it can be heard. And that's where the third step comes in, resonation. The sound wave leaving the larynx bounces around inside our vocal tracts, which includes our throat, oral and nasal cavities. This is where it becomes louder and also adds more character to the tone of the voice. And that brings us to the final step, articulation. Articulation is where we take that unique tone and shape it into sounds like vowels and consonants that we use to communicate. We do that by changing the shape and position of our tongue, jaw, and lips. Now, each of us have subtle physical differences in our instrument, like the size of our larynx, the length of our vocal tract, creating a unique place for the sound to be molded in. But what's amazing is that the life experiences we have, the language we speak, the music we listen to, and our individual personalities, all of this has a huge influence on how we use and coordinate the muscles of our instrument, making us all one-of-a-kind singers. So, to sum up how the voice works one more time, our brain, hardwired to our instrument, starts by telling us to get ready, to inhale. Then we begin the 4 phases of the cycle of phonation. Actuation, the controlled release of air. Vibration, the air triggering the vocal folds to move, creating a sound wave. Resonation, the sound wave bouncing around our vocal tracts, getting louder and taking shape. And finally, articulation, your lips, tongue, and jaw helping shape the sound we use to communicate. So there you have it. That's how our instrument, the voice, works.
Thank you, Jim. I also want to point out, I'm just going to scroll down real quick. As I mentioned, the larynx, that's where obviously our voice box is, and you can feel that vibration right here. It is suspended from muscles attached to the jaw and attached to the tongue. Of all of the dimensions of the voice, articulation is by far the most complex because it utilizes so many muscles. We have a tendency to think of the articulation just being the lips and the tongue, and oh yeah, the jaw moves, but there's just so many muscles that have to coordinate together. And that's one of the challenges that we have on a physical sense of being able to articulate words for those who are struggling with that. To isolate and develop the elements of phonation, again, is super important because it gives you something to identify as to what the issue may be. So I want to give you a few things that you can kind of look for. Before this cycle of phonation starts is the intent to phonate. It's the breath in, this is for speaking or singing, and it's the initial phase, and the brain is in charge of all of this. So if there's an issue in that phase, the signs could be difficulty in conceptualizing thoughts. It could be lack of desire to communicate in the first place, or there could be a delay in response. Now, there's several things you could do to kind of gamify being able to identify if this is an issue. A word association game is a really good one to see the cognitive processes related to wanting to speak in the first place. So you can hold up this. What's the first word that comes to mind? It might be red. It might be crayon. It might be pencil. It might be dog. I don't know. There's almost a no wrong answer. It's how long does it take to react? You can kind of play with this. Obviously, age is relative to this. If you have a 15-year-old doing very well cognitively, I think that's a word, but maybe they have difficulty speaking because of a cleft palate or something like this, this game is not going to be for them. They're just going to get frustrated with you. We have some other things that I'm going to share with you based on the age and where they're at. The next thing is actuation. So that's your breath support. Sign of issues could be if there's breathiness in the voice, they could just be overspending all the time. Maybe they run out of air easily, even if they're not being physically active. Or if the sound of the voice is kind of weak, quiet, and fatigued, there could be a coordination issue taking place even before sound is even being created on a physical level. So it's kind of a cool one for this is blowing bubbles. I don't care how old you are, blowing bubbles is always fun. So the idea with this little exercise is to see not so much how long you can go, but if you can get a consistent flow of bubbles. So it sounds like this. Hopefully you can hear that. If you hear it's like popping all over and water's just spilling everywhere, which is also a good idea why you should do this right in front of your laptop. It's kind of a fun way to give a tactile gamification of being aware of their breath. And then you can time them, you can make it more fun, like, hey, let's see how long you can blow bubbles this time. And that helps them get their brain more actively involved in the action of that. But if they're really struggling with it, that lets you know there's either something with the cognitive part of it, or there's something physically in the coordination of the breathing. That's something to be aware of. The next thing is the vibration. So that's the sound production. That's our folds vibrating, like Jim talked about. Signs of issues is if there's hoarseness. So if the voice is like this, if you see veins popping out of the neck every time they go to speak, that's a problem. If there's weird breaks in the voice, and I don't mean like going through puberty breaks, so that's going to happen anyway. But if it stops and it's cracking all the time or in weird little places, that might be something to look into. And a vocal coach can help with that very often as well. Or if they have an inability to produce varied pitches. So if they're speaking very monotone and they're having trouble physically being able to go higher or lower, they could have just a neurodivergence in such a way where they don't hear the difference between the pitch as opposed to being able to physically make it or not. And that's something to address. So one thing you can do to kind of test this is play with what I call glissandos. It's really just a siren sound. So if you do like a ooh, you can ask them to just kind of mimic a sound going up and down, but have them try it really soft. Ooh, and then try really loud. Ooh. And if they're able to follow those instructions, that takes a lot of control from mental intention, breathing, and vibration of the folds. The next one is resonation. So that's the empty space in the throat, mouth, and nasal cavities. So that's where the sound, those waveforms get amplified. They kind of bounce around, and that really creates your identifiable tone. And the signs of issues there is if there's hypernasality. So everything's going up in there. So a lot of air pressure is going into the nasal cavities. Some of that is mimicked. So I was raised in Western New York. So for half the year, everybody had a head cold, and the other half of the year, everybody was dealing with allergies. So I have a Rochesterian accent. You can hear a little nasality in my speech. That has to do with mimicking the surrounding. It has very little to do with any genetic disposition, but if it's really hyper or disruptive, that's something to look at. If there's just an unclear voice in general, or if there is a lack of clarity or consistency with the tone itself, that's a little bit more complex, but it's something I can dive into if you'd like me to a little bit later. A way to test this is to hum something. So let's do Twinkle, Twinkle, Little Star. So if I go, you can ask your child to do this, keeping the lips closed, and let them listen to what it sounds like. Listen to how loud it is. How does it feel in their body? Do they feel vibration? And then you try the same thing with an open ah. So you're going from to ah. There's a huge difference. I want them to feel the difference, the impact of sound resonating in their oral cavity that amplifies that. So it's kind of a cool little way to play with that and see if they're able to do it. If they're not, that's a little red flag, something to learn from them. By the way, when I say red flag, I don't mean to make it sound negative. It's not. It's just learning about that individual and what their strengths and coordination weaknesses are. And the more you can learn about the structure of their body when they go to speak, the more informed you are, the better decisions you can make. And then lastly, in terms of the cycle of phonation, is articulation. So again, that's our tongue, lip, and jaw, and all those muscles related. So the signs of issues there are mispronunciation, not being able to pronounce words at all or very specific words, slurred speech, or if there's any omission or distortion of the sounds. A fun one is if we take the song, I'll just do Twinkle, Twinkle, Little Star again. So if we're doing Twinkle, Twinkle, Little Star, instead of the words, have them rotate a B and a P sound. So it's a B-E and a P-E. B, P, B, P, B, P, B. It's really complex. If this is too much, that's fine. You can have them just do a single note, any note. B, P, B, P, B, P. The difference between a B and a P is so subtle, yet we can identify it when we listen to it. The subtlety in terms of the amount of air pressure being used and the lips coming together, having what's called a plosive when it opens up for the P versus the B, is a really unique sensation. So start slow, do single notes, try working it into a song is always fun. And this way you can hear if there's a coordination issue with the lips. The other thing to do is DT. This is to do with the tip of the tongue. DT, 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 D. There's GK. G, key, G, key, G, key, G. It's a hard G sound. The idea is that if this is your tongue, the tip of the tongue does the DT. The rear of the tongue does the GK. So you've got lips, tip of the tongue, rear of the tongue, and then a much more complicated one is the W and the R. We, re, we, re, we, re, we. And the idea is to get as much of an identifiable, recognizable sound difference between the consonants, the W and the R, the G and the K, the D and the T and the B and the P. If they're able to execute this, that's really good. So I've got professional singers that this can trip them up every once in a while. But if they're able to do some combinations, but not others, again, it lets you go, oh, okay, so there's either tension here or there is a communication issue between the brain and those muscles, or there's an underdevelopment in the muscles themselves. It's just play to discover if there are any issues that need to be addressed.
Vonberg asked, what does it mean when your child hears a song and repeats different words? Does this have something to do with interpretation of sound?
It could. That's a really interesting question. So are they matching the melody, singing the melody, but just replacing the words incorrectly? If that's the case, the question I would have with that is, are they doing it intentionally? Is it a play, exploratory thing? If you think about it, A, B, C, D, E, F, G. That's the same melody as Twinkle, Twinkle, Little Star, right? So
Yeah, the answer was yes.
okay. So very early on, we learned to take a single melody and introduce different words, different concepts, different storytelling. So to me, that would show a higher processes of cognitive abilities to be able to swap something out. So that's actually pretty cool. The question would be, can they do the actual words as well? If they can't, then you can kind of break it down, slow it down, and make sure they're understanding what those words are. That's how I would address that.
Here's another question that just
Sure.
came in. It says, does the vagus nerve have to be relaxed in order for those muscles used to work properly, or does it matter?
Well, so the vagus nerve, that's the 10th cranial nerve. So that's in charge of your respiratory system, your reproductive system, your cardiovascular system. It is in charge of your digestive system. So it's kind of a big deal. And for singing, there's a branch. It's called the recurrent branch. So the vagus nerve comes down around, it loops around the aortic arc, right around the heart, and comes back up. That's why it's called a recurrent. It's in charge of all the intrinsic muscles of the larynx. So the muscles inside the larynx used to bring the folds together and create sound is run by the vagus nerve. So the vagus nerve technically is never, I don't want to call it relaxed. It's never off because it's always doing something.
Mm-hmm.
But depending on other needs of the body, it can have a huge impact in the coordination for sound production, but not so much for articulation. It's not going to affect the lips, tongue, and jaw as much as it will your breathing and the production of the folds vibrating. So emotional triggers is a major factor when it comes to being able to produce sound fluidly. So it's a really loaded question because it's such a complex concept, but I would say the vagus nerve affects everything to some degree, and it's being able to work with it. The cool thing is that the brain is so flexible, it's so plastic. That's why I call it neuroplasticity, is that you can use conscious efforts to reprogram pathways to get the muscles to coordinate differently. And we do that through the nervous system as well. So the programs are up here, it communicates for what the muscles to do. On a more complex level, there can be what's called nerve blocks. And that's something that Jim, who's just in the video, actually specializes in. And you can look him up at the Bostock Institute. I want to talk about the power of multi-sensory engagement in reading out loud. So we're just talking about what it takes mentally and physically to create words. This is something speech therapists talk about all the time. And for those of you who've gone through this process, I'm sure they've expressed the need for reading out loud. It really is beneficial because we get to use all of those processes we just talked about together. So there's a few major benefits. One is that it helps deepen understanding. When you are engaged with something with multiple senses, your brain is going to absorb the information because information is coming in from multiple angles. So you're seeing something, you're reading it out loud, and you're feeling something. If they can feel the pages and turn the page, it's that feeling of next. So if you can engage the tactile feedback, I highly recommend that. It also enhances retention. So when you're using more sensory pathways in the brain, you're distributing blood flow. So the blood is moving in different directions and pulling on different parts of the brain. And this is going to help strengthen those neural connections associated with information being processed, which also improves your memory of the words and the concepts that are taking place when they're reading out loud. And it also increases engagement and motivation because there's more dynamics at play. You're getting loud and soft, and hopefully you're one of those readers that go totally over the top. The more you do that, the more expressive it is, the more likely they're going to be engaged. And that's really good bonding time for you and your child too. And it also encourages active listening. Communication isn't just about speaking, it's about listening. We need to teach our kids to listen well. So active listening techniques is another thing I want to encourage because that could be one of the issues that took place at the beginning where there wasn't enough active listening, and that made it more difficult for them to be able to communicate. And it also lets them feel more understood and valued. So I've got 5 steps that I want to encourage you to explore to help with that active listening at home. One is to focus fully on the person talking. Okay. So if you're having a conversation with a child, put the phone down, make eye contact, and turn your body. So if they're coming at you in this direction, turn your whole body this way. Give them that full attention. I know it's hard to do this all the time, but making a conscious effort to do this at least occasionally, at least a couple times a day, is really important, because you're also subconsciously teaching them how to communicate to others. So this is a really big deal. Give them the full attention. Avoid interrupting. I will tell you, I struggle with this one because I know where the story's going and I want to finish it for them. You have to give them the opportunity to figure out what's the next word. How do I complete this thought? How do I complete even just the sentence? And if they're struggling with the word, don't jump in to say it for them. Give them time to articulate it. Let them know they're not in a rush to communicate their idea. These are hard to do because you're at home, you're homeschooling. There's 100 things that have to be done that doesn't even have to do with homeschooling. So we cherish time. And very often as parents, I'm speaking for myself, I don't know if this resonates with you, but it can be difficult to prioritize their need for communication over the things that I need to do, because I got to pay the bills and I have to do this and this and this. But we're teaching them what is valuable. So it's a really big deal to remind yourself to do that if you're not already. A really great way to engage with them is to reflect what they said. So if they're coming to you with a story that happened at church or on the playground, then instead of just saying, oh, cool, and moving on, repeat it back. It's like, oh, so Cindy said blah, blah, blah to you, or was this before or after this happened? So have a little bit of an engagement repeating back. That way they could hear, is what I said, was that transferred? Was I able to communicate that? And if you didn't get it right, let them correct you. Let them try again. Okay, this takes time, but it's so worth it. And then as far as the questions, it's always better to ask a question that continues conversation. So it's better to say, how did that make you feel? Or what did you do next? As opposed to setting them up to just say yes or no. So you're really just creating opportunities for them to learn and communicate with you. And then finally, the 5th thing is to show empathy and validation. So affirm that whatever they're feeling, whatever thoughts they had in that story, even if you don't agree with them whatsoever, acknowledge it, at least acknowledge their perspective, even if you want to contradict it. Just like, oh, that sounds interesting, or I can see maybe why you saw it that way. Finding a way to not have to correct them, but rather allow them to have that verbal creativity and acknowledge that. And then if you need to correct something, by all means do that, but give them the feel-good moment of, good job, you did your best sharing your idea with me. Okay, whether it's a super simple concept or very advanced, again, depending on your child, their age level, and their situation. All right, building vocal confidence. So there's a huge link between confidence and effective communication. Sometimes it has to do with a personality. Sometimes it has to do with an issue or a challenge or a disorder of some kind. But the more confident a child is, the more willing they are to express themselves, or at least to make an attempt to express themselves. And that builds to stronger communication skills. The more confident they are, I'll put it this way, the more likely they are to participate in class or to ask questions, because they're not afraid to be wrong. They're not afraid to make mistakes in front of others, even if it's just their sibling or if they have a friend over or something like that. That's really important. They're better at resolving conflicts with their peers because they can communicate their needs and feelings better. And they also tend to be better listeners. And more than likely, they're to have more positive relationship with adults. Again, if they're able to communicate their needs better, there's less frustration between you and them or you and an adult. And that helps to build trust and a rapport with adults as well. And the byproduct of that is usually an increased vocabulary, which is always cool as well. A few simple tips to help children develop the confidence at home is to provide opportunities to practice communicating. This again comes to you active listening. You want to take a moment to ask about their interests. They might like certain games, certain books, certain movies, certain sports, whatever it is. Take time every day if you can, even if it's just one little mini conversation, and ask what they're doing, something they're interested in, so they can practice speaking and not feel like homework. It's not like, I know I have to read because it's 12 o'clock and that's when I'm supposed to read. Don't turn it into a chore. Just ask them questions and let them try to communicate their ideas with you. So you're encouraging it passively. They don't really know it's helping them. That's what it's all about. Value their opinions and how you respond. That helps them build confidence. Encourage them to take risks in social situations. This one's really hard, especially for a lot of kids with learning challenges, social anxiety. I recommend taking small steps and finding opportunity. Even if it's just you and your child, you can do kind of like role-playing games in different scenarios. Like, okay, we're going to pretend we're going to the bank and there's what happens, and just kind of turn it into a game as much as you can to practice those social scenarios. And if you can bring in a friend, a family, a neighbor, and kind of expand upon that, it's good, safe environments for them to get used to communicating in different areas, different circumstances whenever you can. And of course, provide positive feedback. We want them to feel good about their words and their voices because that reflects who they are. By the way, these are good tips for communicating with other adults as well. Very often we don't listen, we don't validate, we don't value their opinion all the time. You might have preconceived ideas. It's just good practice for us to do and have that at home with our kids. It's good for us in the adult world as well. And I recommend, just to kind of help keep yourself accountable with these ideas, is to mark your calendar. Whether you got a calendar on the fridge or a phone, just mark down like, yes, I asked about a story, or I practiced active listening today and I gave positive feedback. It helps you stay accountable, but you can also start to see how much are you actively doing this? Are you making an effort to really help your child through little simple acts to really encourage their ability to understand words and ultimately be able to communicate and express themselves? You can keep a journal and go even more in depth as well.
Jennifer had asked, breath coordination is the biggest factor for my 11-year-old son with praxia, and I'm probably going to murder this next one. I can't even say it. Okay. No one has solved this yet. What would you do that's different from the traditional speech therapy? It affects him physically too, like in swimming.
Inhalation. So very often speech therapy involves a lot, or even just breath work as a whole, has to do with how long can I sustain air, and the measurement of volume of air and regulation of air. The process of efficient inhalation is more valuable. So one of the things you could do is focus on the inhalation through counting. So if he's able to coordinate breathing inward slowly, it creates a whole different pathway in terms of what the body is being asked to do from the brain. So for example, if I were to count to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I spent the air first, I depleted my body, and I focused on inhaling. So I'm creating a sense of efficiency, slowly moving the muscles around my lungs. So you've got the external intercostal muscles, and then you've got the diaphragm that's in charge of that inhalation, because the quality of the inhalation directly affects the quality of the exhalation. And again, I would gamify this. Start with 10 to get the coordination down, and then see how far you can go. So you get rid of the air, and then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. Just have them count quickly and just fill all the way up as far as they can, comfortably. If they're feeling stress, any pain, any discomfort, stop, breathe, have a sip of water, listen to your body, right? So the idea is to just simply beat your own record, whatever that might be, And that way you're gamifying things, and the brain loves that because now you have something to beat. You have something to go for. Yesterday I got up to 22. Today I'm going to get to 23. And that just kind of rewires the efficiency of air. And hopefully you'll see a difference in how they're able to maintain the airflow when they exhale, when they speak, when they're doing exercise and things along those lines. And there's many other aspects, but that's a really good one to start with. So I want to give just a couple singing techniques for boosting vocal self-assurance. I realize this isn't a singing webinar, but if you can speak, then you can sing in the same way. If you can move, you can dance, okay? And for the nonverbal communications, you're still breathing. There's still activity. Even if you're not pronouncing words, if you're inhaling, exhaling, if you have vocal folds, sound can be produced. It's a matter of encouraging muscles to come together to vibrate. That can be in a very individual per basis scenario. So I'm not going to make any assumptions as to why someone is nonverbal. Sometimes it's physical. Sometimes the cause is cognitive. Sometimes it's emotional. But the best way to kind of activate this is through play. It is not through having to sound good. So when we're using singing techniques to develop the voice, it's not about winning a Grammy and going on America's Got Talent or anything like that. It's simply using the instrument, the body that you have, the same muscles you use to speak in a more playful, fun way. That's really what we're looking to do here. So one thing you can do is called pitch play. I've got an app. I recommend Musique, Musique. It's free. So I'm going to make a sound. Hopefully you can see this. Ooh. You can see the pitch go up and down. You can see that movement there. I'm not trying to sing. I'm not trying to impress. It's simply play with visual feedback. That's the point of this type of exercise. Get them to produce any sound, but let them see it. Because when you see it, it triggers other parts of the mind. It starts to kind of get the neurons firing and collaborating, so to speak, to manipulate the sound. And that's what we're looking to do. We want them to use other parts of the brain to create and to express themselves. Rhythm is a really good one to play with as well. I recommend starting with speech. So if you were to say what your favorite color is, you could clap on each of the syllables. My favorite color is purple, as you can see from my background. The idea, again, multisensory, having a tactile sensation of clapping on the rhythmic beat of the sentence, because I'm not doing a song there, I'm just speaking, but there's a feeling of rhythm we want them to be connected with. And then over time, you can turn that into a song. So it could be somewhere over the rainbow. This helps them understand syllables in words on a deeper level, but the feeling of shapes and sounds here connected to something they can see and feel much more with their hands and hear. Again, it drives the brain to kind of bring other muscle groups together at the same time. 10-tone exercise. This is a really important one in expressing, whether it is somebody who has a stutter, or there's a hoarseness in the voice, or they're not able to quite shape the sounds, or maybe there's a deafness involved, whatever it is. The idea of expressing emotions is essential because we arguably can communicate visually more than we can with the words themselves anyway. Our facial expressions, if they're able to cognitively process that, right? Facial expressions, body cues, body language, and also the tone of the voice will tell a story. So if you were to take that sentence, my favorite color is purple, and speak it as if you were sad. So it'd be, my favorite color is purple. So you got a facial expression, the tone of the voice, that's what we're looking for. You can have it happy. My favorite color is purple. You can have angry. My favorite color is purple. Use all these different tonal textures. So get them to kind of play with the sounds. And the older they are, the more comprehensive they may be with this type of exercise, the more emotions you can add, the more complex it can get. And now you're going to have them walk away from you turn away from you so you can't see their facial expressions. And you can say, hey, pick one of those emotions and say that sentence. And then you, as a partner in the game, have to guess what the emotion is. You can role reversal with this as well. If you're sounding really sad and they guessed happy, that's interesting. Either you weren't able to execute that emotion or they weren't able to recognize that. And that's a really insightful concept that you can share, again, with either a speech therapist or a specialist in a different field that could relate to. And this can get really complex. You could do bored, happy, sad, surprised, disgust, anger, go find an emotional wheel and pick things. And it can get really difficult. The other version of this is with the song. So you can sing Twinkle, Twinkle, Little Star, really sad, really angry, really surprised, and see if they can catch what the emotion is. Early on, there was the reference to having someone nonverbal. There's been studies that show that communication is primarily visual. They say like 55% is visual, 38% tone, 7% articulation. I remember what it was. And that's not hard fact, but by and large, we agree that the visual cues are a big part of it. And they've also shown that there is more blood flow activity for our visual cortex than it is any other, let's say, processes that take place in the brain. So when we see someone sing, for example, or see someone speak, our brain prioritizes what we see over what we hear, and even more so over what we hear them actually say. That's why I can listen to music in a language that I don't speak, and I can still get goosebumps. Even if they're not singing, just the movement, the expression can be very powerful. And connecting with that and teaching our kids visually and tonally as much as they can to express themselves is really going to help them build their confidence and learn how to communicate moving forward as well.
Stephanie had asked about anything to work with older kids who are nonverbal. Do you have any suggestions there?
It still comes back to play. So there's different degrees of nonverbal, of course. I'm a big fan of gibberish, huge fan of gibberish, even in singing. So if someone's struggling, like getting a high note, if they're like, somewhere their voice is cracking, I'll have like Shinasorapatura kuseya. If once you allow the brain to pull on other parts of the body, other parts of the brain, and therefore translates to the body through the vagus nerve, it starts to evolve and reconnect and reform possibilities that may have not been there before. So that visual feedback of moving up and down, gibberish to tell a story, that's actually a really fun one to do. Like, okay, you're not allowed to use any words. So take all the pressure off the table of having to speak clearly and say, okay, I want you to tell me how your day was. Oh, and then right, get them to just produce sound in play. And it's a really cool way. And then you can try to guess what they're actually saying. So it's almost like a verbal sets of charades. So play's huge, and it really opens up doors in that communication field.
Very cool. Carrie had asked, any app suggestions to transfer singing efforts into speech for practice?
Well, there's a place called the Vocal Gym that. So there's so many apps available. I think any sort of app that's going to encourage, again, play. Now, it's not about sounding great. It's just getting in touch, the awareness of the body and producing sound. With the Vocal Gym, we have a course for homeschoolers. Again, it's geared towards singing, but it teaches how the instrument works. And through singing, you learn to communicate better. We call it the Vocal Gym because it's about isolating certain muscle groups and developing coordination, which helps in speech. So of course, I recommend what we have. The other thing is take on another instrument. I know that may seem a little disconnected, but piano is a really good tool. Again, you can see, you can feel, you could hear. And what's cool about this is you start to connect singing. It could be C, C, B, A, G, F, E, D. It's pronunciation. There's different vocal exercises that you can do, interactivity. It triggers more parts of the brain. It's more play. It's multisensory. And that's a really cool way to just learn how to self-express through the arts as well. Dance is another fantastic one.
Heidi asks, are there certain things I could do for my daughter that says only parts of words? Her brother's name is Tuck and she says uck, and her sister's name is Tay and she's able to say Tay. Most words she attempts, she usually uses the end of the word.
Very interesting. So, and what is the age? Instead of just saying repeat the word, have them feel the word.
She said he's 6.
Okay, so 6 works. 6 is great. When she says Tay, ask, where does your tongue go when you say that? They're going to look up and they're going to be like, wait, where is my tongue? What's it doing? Because they're not paying attention to that. When we learn speech, we just mimic what we hear until we get it right. It's an echo game that has a lot of errors that take place. So if they could feel, oh yeah, my tongue does that, and play with it. Now make that feeling before you say uck. It's the feeling they're producing. They're not trapped in the idea of producing the sound and just mimicking that. They're in touch with the sensation. And once they get more awareness with the movement of the tongue, lips, and jaw, they're able to shape things much more cohesively.
They were asking about harmonica to practice inhalation. Would that be a good?
That's a great one. That kind of gamifies it more because you have you're sucking air in. So I would aim for a very low volume. And if they can, produce a single pitch on the harmonica versus multiple, because that means they're able to focus their lips a little bit more acutely. And so that takes a little bit more skill. And draw in air for as long as you can. That's kind of a really fun one to do. I am totally going to steal that. Great idea.
Such good information. I mean, I learned a lot just sitting back and listening this whole time. And I thank you all for just your amazing questions. And it just seems like, they're in the thick of it. And
you're not alone.
Yeah, exactly. You're not alone. Do you want to say something a little about your homeschool program just while we're wrapping up?
Yeah, I mean, I think I touched upon it. If you have children who are interested in singing, primarily, the 10 and up, 12 and up, it takes a deep dive into learning how the instrument works, and you actually earn a full fine arts credit. So you can do either a semester or a full year's worth of training. There's hundreds of videos, several different teachers. Take an assessment to start with. You kind of see where your weaknesses and strengths are vocally and then how to build upon them. It's it's a lot.
It is. I did a review on it. So if you look at the SPED Homeschool YouTube channel, you'll get to see just what it looks like on the backside.
Yeah, there's a parent portal too. I want to say that you can actually monitor what your child is doing. So if they're a little bit more independent, you can see what lesson they left off on. It adds up all the time they spend practicing. So it keeps all of your paperwork and everything all in one place. So it makes things a little bit easier.
Yeah. Awesome. Well, thank you again, Richard.
You're very welcome.
Great. And we at SPED Homeschool just are here to support you. I mean, that's really why I started this organization. I've been where you're at, and I didn't have these resources. So excited to just be able to make them available to you. So definitely check out droga.com/homeschool and then come to SPED Homeschool for all your needs. We try to connect you with the best people out there, and Richard is one of them. So we appreciate
thank you so much.
Taking time with us. Thanks, everybody, and have a great night, and we'll see you all soon.